patients will be well. Secondly, as Dr. Ang mentioned, these drugs need to be repeated because the action of the drug is only 4 to 6 weeks. That's all. It lasts for 4 to 6 weeks. So what you're trying to do is to try and suppress it until your own body puts out the fire. That means you're trying to help the body. A bit like antibiotics sometimes. You kill the bacteria, but you need your own immune system to help to treat the infection. Similarly, in this case, by giving one injection not enough, because after 4 to 6 weeks, the same problem will come back. Sometimes what happens is, you treat one area, it leaks in another area. You treat that area, it leaks in another area. It's like a leaking roof. Alright, you patch up one area, next month, another area starts to leak. So, repeated injections may be necessary. Right? And how many injections do you need? We don't know. Some only need 1, some need 3, some need 5. The majority of my patients in Asia, and in Asia we are in Singapore one of the first to use it, and we've been using it very successfully. Our average number is 2.7. That means the majority of people need between 2 to 3 injections. Okay? Monitoring is basically whether the bleeding stops, whether the edema, that means the leakage of water stops, and whether the retinal vision, the improved vision improves. This is how we will follow up. There are some potential side effects in the body. Because, as I said, VEGF is necessary for our normal body function. So if you block it, does it affect your health? Maybe. Especially if you get a lot of injections. 1 or 2 I don't think is a problem. But let's say you have to have 8 injections, 10 injections or more. Maybe it might affect your body functions. What body functions? It can affect your blood pressure. It may cause heart attack. And it may cause stroke as well. So we always ask a very detailed medical history. If you are at high risk, usually we refer to your cardiologist or urologist first. Make sure that it's stable before we start therapy. Alright? And finally, high cost. Unfortunately, the drugs of today, the good, powerful drugs, are also very expensive. So the drug is not perfect, but it is the best treatment that we have had for a long time in treating wet macular degeneration. But more important than treatment, if you think about it, we now should focus our attention on prevention. By the time you get wet AMD, some people will find it too late.